presentation will focus on Burundi as a case study to illustrate what the previous speaker was giving as information. Particularly, I will talk about what we know to date about COVID in Burundi, what is the response of the government of Burundi, and what is the current impact of this pandemic. What do we know to date about COVID in Burundi? First, exact date of the first case of COVID contamination is unknown. Little information was circulated at the start of the pandemic because the government did not take the threat seriously. At the outbreak of COVID pandemic, in particularly with its spread in East Africa, the government of Burundi has claimed that Burundi would be an exception under the protection of God. It was only on the 27th March that a doctor, a director of a private hospital in the capital Bujumbura, had withdrawn after his hospital had received patients suspected for COVID-19 for 3 weeks. It was in a letter he addressed to the Minister of Health. Since then, figures from official sources are a total of around 100 cases of contamination, of which 75 recovered and 1 died. However, the actual data are more higher than those from official sources. Myself, I have friends who confirm that their relatives have died of COVID-19, and there are many. Second, health infrastructure in Burundi, healthcare infrastructure in Burundi have low technical capacities to deal efficiently with the pandemic. They lack reagent products for tests, and they lack also equipment for the treatment of patients. Consequently, no tests, no information on the extent of the pandemic cases, and no measures to protect people in contact with patients. Moreover, in the absence of appropriate equipment, most of the victims die. Second, I was saying that the health care infrastructure in Burundi is of low capacity to deal with this pandemic because there is no reagent products for tests or equipment for treatment of patients. And so there is no test, no information on the extent of the pandemic cases, so no measure to protect people in contact with the patients. And moreover, in the absence of appropriate equipment, most of the victims die at home, and consequently, it is impossible to have reliable data or no victims, no statistics. And third, the people live in fear of something they don't know enough, they don't have enough information, and for which they don't see the exit. Talking about the response of the government from human rights and the governance perspectives, the response of the government is bad since the beginning of the pandemic. It has not been transparent. There has been an excessive obstruction of information about the extent of the COVID contamination. Local actors and the media are forbidden to talk and communicate about the pandemic. This is a violation of human rights principles, particularly on the freedoms related to information. Some measures have been taken by the government, but they are not enough. Also, the enforcement is insufficient. An example is that on May 6th of this year, the newspaper Le Figaro wrote, in Burundi, the president Pierre Nkurunziza relies on God to counter the epidemic of coronavirus. Another thing to say is the deterioration of relationship between Burundi and the WHO. Serious divergences led the Burundian government to declare the representatives of this UN organization persona non grata in the middle of May. Similarly, the representative of World Health Organization in Equatorial Guinea was also asked to leave the country early in this June. So the problem is not only in Burundi, despite the relations between local government and the international community. Such isolation of the government and the country is a big challenge to the international solidarity and support to the COVID-19 responses. The last point I would like to give my comment is on the impact of COVID on security and governance in Burundi. Two elements to mention. The first one is that COVID in Burundi is very threat for health of the people. For example, the Minister of Health himself has been treated in Kenya for COVID-19, but in Burundi, no official information about that. At the end of May, the First Lady of Burundi was airlifted to Nairobi in Kenya for emergency care and was tested COVID positive according to newspapers and the information from Kenya. But in Burundi, no information about that. And when she went to the airport, the light for the airport was switched off to avoid that people could see her leaving the country. Few weeks after, his husband, the late president of Burundi, died on 8th of June. It's June. In its official announcement of the death, the government stated that he died from a cardiac arrest after 2 days in an hospital. But they hid the real cause of the rapid deterioration in his health, which opened the door to speculation, including the death by COVID. The second one is that the government took advantage of COVID to strengthen its isolation. For example, the government rejected the request of the East African community for electoral observers during the general elections, which took place in May this year. And the elections were not credible, and several serious irregularities have been denounced by independent local observers from the Catholic Church. From the economic perspectives, the isolation of Burundi will worsen the already difficult economic situation of the Burundians. The collapse of the economy following the crisis, which started in 2015, has pushed Burundi behind all nations as the poorest country in the world. So to conclude, Burundi is a typical case of among countries where the leadership has been unethical or ineffective in the management of the pandemic. And if serious measures are not taken, I think the situation could be tough in the coming weeks or months. Thank you for your attention.